16 people have already died from suspected overdoses this month in Knox County alone. The District Attorney General's office says that brings the total to 215 deaths so far this year. 293 people died from suspected ODs in all of 2017. Now, the majority of the people who overdose survive. A new initiative started by the Knox County Health Department gets overdose victims help so they won't overdose again.
10 News reporter Mark Salinger shows us how the supporters of this program hope it does impact and reduce those deaths tied to overdoses. Mark?
Research from the Knox County Health Department shows those who overdose are more likely to overdose again. The goal now is to intervene in the hours and days following an overdose when people are more likely to want to seek help.
Response to an overdose, 5400.
Day after day, the Knoxville Fire Department uses naloxone to save people who overdosed.
On average, 3 people a day in Knox County get naloxone.
The hours and days following an overdose can be critical to turning lives around. With the help of the Knox County Health Department, first responders are now targeting overdose victims to try and get them help.
About 2/3 of the people who overdose survive. So we want to capitalize on that opportunity to say, hey, what do you need in your life that's going to make a difference?
The program is new. The health department hired an early response case manager within the past 6 months, and KFD started teaming up just a couple weeks ago.
We get notified from Knoxville Fire Department that somebody's overdosed, and if they survive, we connect with them.
Overdosing once can lead to more overdoses.
Your biggest risk for overdosing is having overdosed before. People who overdose are likely to overdose again.
Still, research shows only a small percentage of people who are given naloxone need it more than once. Between October of 2016 and September of 2017, 1,268 people were administered naloxone in Knox County. Of those, 93 people had received the overdose reversing drug on at least 2 occasions in the same time period. The goal is to bring that number down to 0.
The ultimate success would be that people get clean and stay clean.
And this program will help people get any help that they need to stay clean. That includes addiction treatment options, HIV treatment, or really any other access to other services. Robin and John.
All right. Mark, thank you. And if you or someone you know is struggling with addiction, we have a list of resources online at WBIR.com. Just go to the menu at the top of the screen and click on the Features tab, then scroll down and choose OD Epidemic.